Hello friends, in today's video we are going to discuss important topic femoral triangle. So what do we basically understand by femoral triangle? Femoral triangle, it is nothing but it is a triangular depression. It is a triangular depression in front of the thigh below the inguinal ligament. Okay, it is a triangular depression. So we will discuss this topic in bits like boundaries. First we will discuss all the boundaries, what are the boundaries that form this femoral triangle, then the content, and finally we will discuss the clinical anatomy about that. Okay, so first let's understand what are the boundaries of this. Lateral boundary, medial boundary, apex, base, roof, and the floor. So these are the contents in which we are going to discuss the boundaries. So first of all, we know that this is the inguinal ligament. Inguinal ligament, it extends from the anterior superior iliac spine to the pubic crest. Okay, so this is the inguinal ligament, and basically inguinal ligament, it forms the base of this femoral triangle. Now what are the other boundaries? That is the lateral boundaries. Basically it has been formed by the sartorius muscle. Okay, sartorius, it is the longest muscle of our body. Okay, it forms its lateral boundary, sartorius. Medial border of sartorius, to be more specific, and the medial boundary it has been formed by the medial border of the adductor longus. Adductor longus. What forms the apex? Here is the apex and this is the base. Apex has been formed by the intersection at the point where the medial and the lateral boundary meet each other. It is the point where we can see the apex, and this is the base which is formed by the inguinal ligament. What forms the roof? Roof is basically nothing but the upper structures above the femoral triangle. What we are going to appreciate, by the common sense we can understand, there will be skin, then superficial fascia, deep fascia. Yes, but it is not limited to this. Superficial fascia, it itself is containing some of the contents. Like what are the content it contains? Like the superficial, it contains, it is also having the superficial inguinal lymph nodes, then genitofemoral nerve of a femoral branch of genitofemoral nerve. Okay, branches of ilioinguinal nerve. These are some of the contents that you can appreciate in the superficial fascia. Deep fascia is also there. Deep fascia, it is also present, and along with it is having the cribriform fascia of the saphenous opening. As we know that saphenous opening is the opening where the great saphenous vein is going to drain. Okay, and this is the point where it is having the cribriform fascia. Okay, then this is the roof, then floor is basically the base. Yes or no? So the floor is been formed in two contents. We are going to discuss in the two contexts, that is the medial and the lateral. Medially the floor is basically formed by the two muscles. What are they? That is the adductor longus along with pectineus muscle. Okay, so medial we are having the adductor longus along with pectineus, and laterally the floor is basically formed by the psoas major and iliacus. Okay, that is the nothing but the boundaries. Have you understood that? Okay, we have discussed now the boundaries of the femoral triangle. Now we'll discuss the contents. So what are the contents? It is very important. We'll see them one by one. So from the name, if you just keep a watch, it is femoral triangle. So the content is femoral artery, femoral artery and its branches. Femoral artery and its branches. Where you will appreciate this femoral artery, it is originating from the mid-inguinal point behind the mid-inguinal ligament. Okay, it is here and it is present. You can see the femoral artery. Okay, and in the exam we cannot write the content like femoral artery and its branches, femoral nerve and femoral vein and its tributaries. Just we cannot just enumerate that one. We have to have a description about that. So about femoral artery we can write that in the femoral triangle, its extension you can write, and also you can write that in the femoral triangle basically it gives off three superficial and three deep branches. What are these three superficial and three deep branches? For that I have made a separate video about the femoral artery. You can watch that one. Okay, but at least that one we have to write. Okay, then the next is the femoral vein and its its tributaries. Basically, femoral vein, it is present. Its position with respect to the femoral artery is different. See, at the base, if you will see, this is present medially, but at the apex, if you will see, it is present somewhat posteromedial to the femoral artery. Okay, that is nothing but the femoral vein. And basically, what are the tributaries of this femoral vein? It is the great saphenous vein. Great saphenous vein drains into it. Okay, great saphenous vein. Then we have the circumflex veins. Circumflex veins draining into the your femoral vein, and also some of the branches of the that accompany the branches, the veins that accompany the branches of femoral artery, that also drains in this femoral vein. Okay, then next we have the content, that is femoral sheath. Femoral sheath. Femoral sheath, it is nothing but a covering. Okay, it is a covering 4 centimeters. Okay, it is a sheath which covers the upper 4 centimeters. It is a sheath which covers the upper 4 centimeters of the femoral vessels. Okay, and to give a description about that one, the femoral sheath, it is basically divided into three compartments: lateral, intermediate, and the medial. Lateral compartment, it is having the femoral artery. Intermediate compartment of femoral sheath contains femoral vein, and the medial compartment basically consists of lymph node of clockwise. Okay, this is about the femoral sheath. Next is the veins. Next is the nerves. Okay, so basically 4 nerves are there in the content of the femoral triangle. So what are these nerves? Of this, first is the femoral nerve. Femoral nerve. Femoral nerve, basically you have to understand that femoral nerve, it is present. Where it is present? First of all, femoral nerve, it is present lateral to the femoral artery. It is present lateral to the femoral artery, and it is not a content of the femoral sheath. Okay, we can appreciate that, and also I have told you this is the femoral nerve. Femoral nerve. Okay, and femoral nerve, basically it lies in the groove between the two muscles. Which are these two muscles? Basically these are the Yes. Psoas major and iliacus. Between that two muscles, there is the presence of the femoral nerve. Next nerve is the nerve to pectineus. Nerve to pectineus. This nerve to pectineus, basically, it is nothing but a branch of femoral nerve only. But this branch arises from above of the inguinal ligament, and it goes behind this femoral sheath and comes above and supply the pectineus muscle, which is present over here. Okay, and it supplies the your pectineus muscle by passing from behind of this sheath and then coming anteriorly and supplying the pectineus muscle. Next is the nerve to pectineus. Then again one nerve, that is the genitofemoral branch, or you can say that femoral branch of genitofemoral nerve. Okay, femoral branch of genitofemoral nerve. Okay, this femoral branch of genitofemoral nerve, it is present in the lateral compartment of the femoral sheath. Okay, along with it is present along with the femoral artery, it is also present, and it is the lateral in the lateral compartment of the femoral sheath. And this the importance of this nerve is that it supplies the skin over the femoral triangle. Okay, then what is the next nerve? That is the lateral cutaneous nerve of the thigh. Lateral cutaneous nerve of thigh. Okay, lateral cutaneous nerve of the thigh, where is it is present? Basically, the description about that is the lateral cutaneous nerve of the thigh. It crosses the lateral angle of the femoral sheath, and it basically divides into anterior and posterior division. And these divisions, basically anterior and posterior division, see, anterior division will supply the anterolateral portion of the thigh, and the posterior division will supply the lateral aspect of the gluteal region. Okay, understood? These are the nerves regarding the content of the femoral triangle. Finally, the fifth is the deep inguinal lymph nodes. Okay, deep inguinal lymph nodes is the content. Deep inguinal lymph nodes. Deep inguinal lymph nodes, what is the about that? This deep inguinal lymph node, it is present deep to the deep fascia. That is, it is present behind of the deep fascia. And this group of lymph nodes, in this group of lymph nodes, basically what are the drainage things? That is, clitoris from the females. The lymph from this clitoris is drained into this deep inguinal lymph nodes. Also, from the glans penis in the males, the lymph is drained in this deep inguinal group of lymph nodes. And also, the lymph from the deep lymphatics of the lower limb, it is also drained in this deep inguinal lymph nodes. Okay, so this is the boundaries and contents about femoral triangle. This one I have told you, that is the adductor longus. This muscle is the sartorius. Okay, and these are the boundaries and contents. Now we'll discuss the clinical anatomy related to the femoral triangle. So now we'll discuss the clinical anatomy regarding the femoral hernia. So regarding the femoral triangle, so we are going to discuss it as femoral hernia. It is a very important clinical case from medical point of view. So before understanding femoral hernia, let's understand what is hernia. Hernia is nothing but it is the abnormal protrusion of the abdominal content. Okay, it is called as a hernia. And femoral hernia, this protrusion of abdomen which is occurring abnormally in the femoral area, that is nothing but the femoral hernia. So in this, we have to first of all understand that from where is this femoral hernia occurring. So femoral hernia, it occurs via mainly via the femoral canal, because femoral canal in the femoral triangle area, it is the point of potential weakness from where the abdominal content can protrude outside, can bulge out and form the femoral hernia. Okay, that is the first point regarding that one. And this femoral hernia, it is more common in the case of females. So why it is common in the case of females? Because it is more common in the case of females because of two reasons, that is wider pelvis and second is the smaller size of the vessels. These are the two reasons for the common occurrence of the femoral hernia in the case of females. Third point regarding this one is the what are the different parts of this hernia. Basically the hernia, it is consists of a neck and a sac. So this narrow part you can see, it is nothing but the neck of the hernia, and this bigger part you can see here, it is the sac of the hernia. And the content of hernia, it is the bowel, it is the loop of the bowel. Fourth, regarding the this point is, what is the treatment that can be taken? The treatment for this is the reversal via the surgical process is the thing that can be done for the femoral hernia. So that is the treatment. The final point regarding this one is the course. What is the course followed by this loop of bowel, that is during the hernia? So the course that it follows is nothing but the loop of bowel or the small intestine, it comes downward, it first goes downward via the femoral canal. Okay, because it is the point of potential weakness, from there it can protrude outside. So it first of all goes downwards via the femoral canal, then it goes forwards from the saphenous opening. I told you that it is opening from where the great saphenous vein drains. Okay, so from that opening it goes forward and then again it goes upwards along with the superficial vessels like superficial epigastric vessels, superficial circumflex iliac vessels. Along with it, it goes upwards. So this is regarding the femoral hernia, that is the clinical anatomy regarding the femoral triangle. Today we have discussed the femoral triangle in detail about the boundaries, contents and the clinical anatomy. Hope you have liked the video. If you like the video, please like, share and subscribe. Thank you.